In this video, we are going to talk about a quick mobility test that you can do on your infant to see if they are struggling with trunk tightness or decreased mobility in their trunk, and also what you can do about it if you notice that this test looks different when you complete it side to side. Stay tuned. Hi, I'm Dr. Lauren Baker, a pediatric physical therapist, and on this channel, we help proactive parents learn how to help their kiddos move better. Think of me as your physical therapy bestie, helping you figure out ways to help your kiddos move with confidence and ease. In today's video, we are going to go over a mobility technique that I absolutely love that can be a really quick way to figure out if your kiddo has any mobility restrictions when you look at it side to side. One of the things that a lot of parents don't realize, and a lot of parents just truly aren't taught, is that babies specifically can have trunk restrictions. And if they have tightness in their trunk, especially if one direction is easy and one direction is really hard, then they're going to develop patterns where they prefer to go in one direction. And those asymmetries can develop into muscle imbalances and also limit their ability to hit some of these gross motor milestones that are so big, like sitting independently, crawling, and walking. It doesn't necessarily mean that they'll never hit those milestones, but what it does mean is that their journey might be a little bit more difficult than it really needs to be. And that's where this video comes in. If you find that this video shows that there is a big difference from side to side, my biggest recommendation would be to contact a pediatric physical therapist or a pediatric physiotherapist in your area so that they can help you really delve into what those restrictions are looking like, get their hands on the kiddo and figure that out. But if for some reason you don't have one in your area or you're just not really sure how to get a hold of one, stick around to the end of this video because I will show you one of the ways that you can work directly one-on-one with me to get those questions answered. Another way to look at baby's flexibility is the elbow to knee. And so I'm going to see whether they're symmetrical. So we're going to take this knee, and like she can really easily get that elbow to that knee. And so that would be her right elbow to her left knee. And now I'm going to try the left elbow to the right knee. Hi. Oh, I'm sorry. Did we not like that? And that one's actually okay, but it's a little bit harder. You guys through really quick my hand placement for this technique because I know it was really quick in the video. So I'm gonna play it through and kind of walk you guys through it. So the biggest thing that you're gonna wanna see here is that I have my hand behind her shoulder. So she's not a happy friend there, but I have my right hand behind her shoulder and my left hand underneath her knee. And I'm trying to bring them together, but in order to bring them together, I have to get that rotation. My left hand is gonna go underneath her right shoulder and I'm gonna bring my hand in a C shape to try to get that knee to that elbow. But you can see how her pelvis is lifting there. So in order for her to get that elbow to that knee, that pelvis has to go into a lot of pelvic flexion. And then you can see when we go to this other side that her pelvis is not going to necessarily lift up that much because this side is harder for her to do. So that left elbow going to that right knee is more difficult for her. So really right there where that right rotation at that end range was more difficult. I wanted to go a little bit more in depth with this mobility test. I know that that video and that demonstration was really quick, and so I really want to kind of break those movement patterns down for those of you who really want to fully understand maybe what is going on here. So when you bring your left elbow to your right knee, so you can do this on yourself and think as I'm teaching you guys how your body is moving, but then also how your kiddo's body is moving. So in order to get your left elbow to your right knee, you need to be able to rotate your upper trunk to the right and then also bend at the waist in order to get your elbow to that knee. So there's some flexion happening at the spine because you have to bring your elbow forward to get to your knee. There's rotation so you can get your elbow towards your knee, and then a little bit of side bending as well in order to really be able to get that elbow to touch that knee. If any three of those directions are tight, either right rotation, flexion, or a little bit of left side bending, then that's going to make that more difficult. If you notice a big difference side to side, say for example, it is really easy to get your left elbow to your right knee, but you really cannot get a child's right elbow to their left knee, then the likelihood that rotation is the biggest limiting factor there is probably pretty high. One thing to note is that typically in kiddos, rotation at the upper trunk tends to be the most limited, as well as side bending on the lower trunk. It is what I find in my practice. And so if you struggle bringing a right elbow to a left knee, then that left upper trunk rotation might be more difficult for that baby. Now, you might see this that they prefer to keep their head to the right most of the time, so you might see it in the neck. You also might see it in the trunk, like maybe they only always go to the right to go get their toys, but they're not going to the left. If you have a really little baby, they're only pivoting on their belly in one direction, but they're not pivoting on their belly in the other direction. So these are a couple of ways to kind of see, hey, are there things that I'm noticing pop up as I watch my child move? Do I notice that there's more of a resistance in one direction versus the other? And if so, the biggest thing that you're going to want to do is to find somebody who can really get their hands on your child and teach you some strategies. Don't want to, necessarily freak out if your kiddo does have a limitation in one direction versus the other. You just want to take that as a data point and utilize it so that you can then be proactive. So hopefully this video showed you one of the ways that you can really look at mobility on your child and really see how the body moves potentially differently from side to side and gather more data if a kiddo is struggling with diagnoses like plagiocephaly torticollis or is showing decreases in rolling, crawling, sitting independently. All of those milestones require the movement of the trunk in different planes. And so if you don't have that movement in multi-plane motions, like bringing the elbow to the knee, then it's going to be harder to build upon them to get to those harder milestones further down the road. Again, like I promised, one of the ways that you can work one-on-one with me is by checking the pinned comment. You'll find a link there to schedule an online consultation with me. And one of my absolute favorite things to do is chat with parents on information regarding where a child is in a specific milestone, how those milestones both before and then after really build on each other, and different exercises that parents can safely implement depending on which stage of development their child is in order to help them get to that next stage in a really strategic manner. If you have any questions, or if there's something you are Googling and you absolutely cannot find it, definitely drop it in the comments below and I will make sure that I share any resources that I have with you, and or find some if I don't have a video on it myself.